Okay, I just got a phone call that I need to go assist in room 203 to manually ventilate a patient that has a compromised airway. So I'm going to go ahead and bring a couple oral pharyngeal airways to make sure I have the correct size and an Ambu bag. Upon entering, I knock on the door, said Kate with respiratory, come on in. The patient's not responsive. I'm going to go ahead and put on some gloves, wash my hands, put on some gloves, and quickly bring over my airways. I'm going to measure to make sure I have the correct airway. The flange needs to sit at her mouth and go to the tip of the ear. So this one looks like the best choice, a 10 centimeter Udell airway, closed airway. So we're going to go ahead and chin tilt and insert the airway upside down, and on the tongue halfway, go ahead and rotate 180 degrees. The flange is resting there. Now I have a secured airway for my patient to ventilate her. I have an amp bag here. I'm going to hook up the oxygen to the wall, and I'm going to continue with my chin tilt here and start administering breaths. I need to make sure I have a tight seal on the patient, and I'm going to be watching her chest rises and allowing the Ambu bag to completely refill. I want to administer breaths 12 to 20 breaths per minute. If it is a CHF patient, I'm going to actually do it a little bit less. You do not want to hyperventilate a CHF patient. So if she had congestive heart failure, we're going to probably keep the rate to about 8 to 10 breaths per minute. I'll go ahead and show you this rate right here is about 20 breaths per minute. And I'll continue doing this until I hear some further instructions if we're going to intubate the patient or what we need to do next.